Good afternoon, everyone. Happy Friday. I can't believe it's snowing. I'm not sure what else can be thrown at us right now, but we can handle it, whatever it is. I know it's been a long week for everybody, and a long month, and a long 8 months. So I want to begin by just taking a breath, collective breath for the people of Rhode Island, and thank you for tuning in today for this special Friday press conference. As a reminder, next week I plan to be here on Thursday at 1 o'clock instead of Wednesday at 1 o'clock. Okay, just a few important announcements today, but before getting to that, I'd like to take a second to look at the data, as we always do, and ask you to please put the dashboard up. Yesterday we saw 482 cases out of about 14,500 tests for a percent positive of 3.3%. And very sadly, another 6 deaths. So I had hoped that maybe today I would have better news, but unfortunately things aren't getting any better. 3.3% is high, and likely it's on its way up, and nearly 500 cases. It's as I said, it's not where we want to be, and sadly we know the next chapter of this book and the next scene in this movie if we don't make changes today. So today I'm here to announce the first of 2 rounds of changes to our guidance as it relates to COVID. I'm going to give some new guidance today, and then some further additional guidance next Thursday. In the intervening time, I'm going to be spending a lot of time with my fellow governors in the region, have been in very close contact with the governors of Massachusetts and Connecticut yesterday, and plan to do that throughout the weekend. The purpose is to have a closely coordinated effort, especially as it relates to changes that might impact commerce. And quite frankly, I really want to keep this round of regulatory changes as targeted as possible. So today is round 1, and we'll be back next Thursday for a little bit more information and possibly an announcement in concert with other governors. Here's the main point that I want to make today. We have a chance to turn this around. So right now in Cranston, we have a field hospital with over 300 beds ready to go. It is ready to go, because currently we're on a path to open it up in a few weeks. If we do, that's hundreds of people who will be in that hospital who don't need to be there. It's about $50 million a month for us to operate that hospital fully operationally. And it's a lot of pain and suffering that we could avoid if we all decide right now to make some changes in our personal lives. That's tough to hear, I realize, because we're all sick of it. And I hear that. But we all have a moment right now, each and every one of us in our lives, to save lives. Doctors, nurses, firefighters, police officers, they can save lives every day. But for the average Rhode Islander, we go about our days, we're not thinking about our opportunity to save a life, our opportunity to keep somebody out of a hospital, our opportunity to allow somebody to keep their job. That's what you have right now. And it's possible for every one of us to do it by taking very simple steps. Write down on a piece of paper right now the 10 or 15 people that you absolutely have to be near. And by the way, 10 or 15 is in the high end. It should be your family, your couple of coworkers, I don't know who else, maybe a doctor. And commit that you're only going to see those people for the next couple of weeks. Commit that you're going to wear your mask all the time, everywhere, except when you're with the people who you live with. because that's what we need to do right now. If you want to keep that field hospital empty, as I do, if you want to save lives, if you want to help people keep their jobs, then that's what we all need to do. And so that's what I'm here to ask us to do. I was on the radio this morning, asked the governor, I do it once a month or so, and the questions were pouring in from our friends and neighbors, and you could hear the anxiety through the phone. Governor, I need my job. I can't feed my kids. Governor, I'm desperate to visit my loved one in a nursing home. Governor, I cannot get enough staff in a healthcare institution. The answer to all of that suffering, which is happening in every neighborhood in Rhode Island right now, is for us to follow the rules, to follow the new rules of very limited social networks and constant mask wearing. And getting rid of any activity that's not essential. Going to school is essential. Going to work is essential. Going to the doctor is essential. Going to the grocery store, I understand that. Going out to dinner with 10 of your friends, going out to a party, having people over for Halloween, not essential, and is going to cost lives and cost jobs and contribute to suffering of people Rhode Islanders love. We are 1 million people strong, and it's our moment to pull together and rise above and turn the dial down on this virus. We're a team of 1 million, and I'm asking you to ask yourself what you can do right now so we can change our result and keep that field hospital empty. We have gone through the data extensively, all the case data, and it's pretty clear where the problems are coming from and what the trends are. And I want you to know what that is, and I also want you to know what is guiding my decisions. Number one, we want to make very targeted interventions. It's not March, and in March I had to make brutal decisions. Close all schools, close all restaurants, close all businesses. We don't want to do that, and we shouldn't have to do that. We can make a more sophisticated, targeted approach right now. Hopefully. By the way, if the trend goes on for another week or two, we can't. Then it's back to shutdown. But hopefully everyone heeds this now, and we preserve the option of staying targeted. And so that's my goal. Principle number one in making the decisions I'm announcing: stay as targeted as possible. Limit commerce as little as possible. That's the second one. Protect jobs. Limit commerce as much as possible. Folks need to work. People are struggling. Too many businesses are hanging by a thread, if at all. So we want to really make sure we maximize the public health benefit of any changes that we make, but minimize the impact to people's livelihood. And the third thing is we got to keep our kids in school. Children deserve the opportunity to learn in school, and we're seeing very, very disturbing results of kids being at home. Child neglect, domestic violence, children falling behind, mental illness. It's heartbreaking. We have to keep these kids in school. Also, I worry greatly about the impact on the spread of COVID by going to virtual school, because the rate of spread in the virtual is higher than in person, and that is because we know structured environments is the name of the game right now. Unstructured gatherings is the huge problem. Structured gatherings, structured schools, structured workplaces, structured worship where folks are, wearing a mask, where people are. That is what we have to get to. And so not only do children suffer when they're out of school, it's highly likely that letting school out at this point would exacerbate our COVID problems. So those are the three principles: as targeted as possible, as long as possible; limited effects on commerce, as long as possible; keep our kids in school. So the theme of all of that is it's time to crack down on unstructured social settings. Transmission is happening when we're comfortable, when we're informal, and we're with people we know. We're doing a pretty good job, better than pretty good, frankly, following the rules at work, at school, at manufacturing operations. Not perfect, you know, at retail stores, at grocery stores, but it's in the evenings and weekends and is when we let our guard down. By the way, that's understandable. It's human. Of course, you want to have a birthday party for your kid. Of course, it's your friends who you have over, so you want to give them a hug. It seems strange to wear your mask in your house with your best friends. It's human. It's understandable. It's got to stop. It's a problem. It's getting us into big trouble. Also, we're heading into a season which is a wonderful season in New England. You know, we have lots of holiday celebrations coming up. We want to be able to enjoy them, which means we really have to crack down now. So, effective immediately, I'm reducing the social gathering limit from 15 to 10, and I'll be signing an executive order later today to that effect. By the way, that needs to be a stable, consistent, closed circle of a maximum of 10. If you could keep it to 5, that would be better. You know, some people have a family of 6 people, so that's why I opted for 10 and not 5. But if you can keep it to 5, keep it to 5, but the law is now 10. It's a closed circle. It does not mean you see 9 people on Monday and another 9 people Tuesday and another 9 people Wednesday. Shrink your social network. As I said earlier, write down the names of the people you're going to see socially, and by the way, and stick to that group for the next 2 weeks. For the next 2 weeks, be religious about sticking to that group of 10 people who you're going to see. Maximum 10. And by the way, even when you're with them, wear your mask. For a while, we were all in a great discipline of kind of living in a pod. Let's get back to that. And wear your mask, even when you're with the people in that small social network. Now, I want to be crystal clear. The limit for social gatherings for 10 is for unstructured, informal social gathering. Basically, you know, parties or a version of a party. Please put up the screen to define what we're talking about here. House parties, dinner parties, brunch, game night, friend gatherings, family gatherings, sleepovers. You know, and that isn't the extent of the list, but hopefully you get the point. Birthday parties, baby showers, girls' night out, kids coming over to the house. This is where the spread is happening, hanging out with people after work. What's not a social gathering? Offices, schools, buses, manufacturing operations, basically other controlled settings where it's easier to keep a distance, where your guard is up, and where you have your mask on. The spread is happening in casual social settings, not so much in larger structured environments. And the fact of the matter is, we are just seeing too many parties. And maybe you're hearing me and saying, no, Governor, it's not happening. I'm here to tell you it's happening. We have spent all day, all night in the past couple of weeks pouring through the data, and it's clear as day. Birthday parties are happening, baby showers are happening every single week. It's because it's showing up in our contact tracing data. We ask somebody who they were with, and they tell us. I was at my girlfriend's for a baby shower. There were only 12 people, but nobody had a mask on, and it was just a group of friends. That's got to stop. That should not happen. For the next 2 weeks, please do not do those kinds of engagements. Last week, among people who reported attending a party of some kind or one of these gatherings, the average party size was 23. Effective immediately, social gathering limit is 10. If we hear in contact tracing you had a party with 23 people, we're going to find out where that was, and we're going to fine the host up to $500 for every person above 10 who was at that event. We had an instance a couple of weeks ago. 15 teachers went out to dinner together. As a result, they all wound up in quarantine. Very disruptive to those schools. Just yesterday, our case investigators identified a party among high school students in the East Bay. There were at least 20 people there, possibly more. We're still trying to figure it out. Even at 20, it's too many. From that one house party, we've already identified 5 positive cases, with more still getting tested. Because of that one party, at least 4 different school districts will be impacted, hundreds, possibly 1,000 people quarantined, and we have an entire team of epidemiologists spending their time getting to the bottom of that one event. That is time and resources of those people that could and should be spent, dealing with other issues related to COVID. So what does that mean? That means because a couple kids decided to have a big sleepover, the lives of hundreds of Rhode Islanders have been totally disrupted. Parents, we can't let that happen. I know it's normal. My kids love sleepovers too. It cannot happen for the next 2 weeks. Do not let it happen. And in that instance, we are investigating. We're going to get to the bottom of it. If it is as egregious as we think it may be, everyone who was there above, at that time, the limit of 15, the host will be fined up to $500. And now, effective today, the limit is 10. That's the kind of stuff that's getting us into trouble. And again, we're seeing it in the data. It's crystal clear in the data. The number of contacts people have is too high. The number of parties we're all attending is too high. And it's all harmless. It's normal human activity. Have friends over to watch the game. Have friends over for a sleepover. Have friends over. I get that. You just can't do it right now because the consequences of that right now are too high. We have a couple of weeks to get back on track. So let's refocus and get back on track. Okay, secondly, a word on masks. It is absolutely vital to wear our masks. It's incredibly simple, cheap, and effective. So, as I said earlier, we need to be wearing our masks in every instance. But I want to take a second to particularly talk to store owners, retail owners, and restaurants, but in particular store owners. So in a restaurant, you need to keep your mask on when you're talking to your server and when you're not eating or drinking. So let's all of us remember that, and I'm asking, please, for restaurant owners and workers to remind your customers and to also have masks ready to hand out if folks forgot their mask. We don't want conflict, we want compliance. So if someone forgot a mask, offer them one, ask them, could you please put it on while you order. I'm also calling on retailers to not only post the mask wearing requirement, but to actively remind customers who are not wearing their mask that they must do so. So this is going to be a change in our regulations. You have to do a little more now if you run a retail operation than just post the mask wearing guidance. If you see someone walking around a grocery store or a retail shop, you have from now on an active obligation to ask that person to please put a mask on or leave the store. And I would suggest you offer them a mask. If they're in an aisle and they don't have a mask on, simply offer them a mask and ask them to put it on if they want to remain in the store. We're going to start getting much more aggressive with respect to fines if retailers are not following this new regulation, which is imposing on them an affirmative obligation to ask people to put their mask on. Okay, I want to talk about sports for a minute. Another area where we're letting our guard down and getting too close to people we like is at sporting events. Again, a normal, fun thing to do, something I have done for years with my own kids. Here's the problem. Parents show up at games, and the natural thing that happens is you stay closer to your friends. You stay very close to your friends for more than 15 minutes and often don't have a mask on. And again, it's showing up in the data. We're seeing lots of cases linked to spectators at sports. So, effective immediately, we are no longer allowing spectators at sporting events for 2 weeks, just for 2 weeks. I know this is tough. We're going to write up the regulations. I think we're going to have exceptions for little kids because it's hard to let your 5-year-old play unless you're there watching them. But the reality is this. The high school sports season only has a couple of weeks left before they start the playoffs, and I really want to allow these kids to finish their season. So one way to do that is for us to not go be spectators. So starting today, for the next 2 weeks, for kids' sports, no spectators. Like our neighboring states, we're also seeing spread at indoor sports facilities like ice rinks and indoor facilities that have like indoor soccer, indoor volleyball, indoor basketball. Actually, Massachusetts and New Hampshire have closed their ice rinks a couple of weeks ago. And with the compounded danger of a close contact activity in an indoor arena, it's too easy to spread the virus in these facilities. And quite frankly, I don't want to get to where Massachusetts and New Hampshire have been. I think we can learn a lesson from that and tamp it down a bit before it explodes. At this point, 1/3 of the youth sports cases that we've seen in Rhode Island have all been associated with hockey. So effective Monday, we will be closing all ice rinks and indoor sports facilities for 1 week. You might say, why 1 week? Because in that 1 week, we're going to be working very closely with the owners of the ice rinks and the indoor sports facilities to come up with new protocols and rules and regulations with the hope that after a week they can reopen. So what am I talking about? Testing protocols, contact tracing protocols, locker room protocols, mask wearing protocols, and the like. It's complicated. The truth of the matter is hockey, the official hockey season is a winter sport, and we want to be ready for that. We want these kids to be able to pursue that. So we're going to lock it down right now because we're seeing extremely disturbing trends. And again, we don't have to wait till we have a problem. We see the problem. So we're going to lock it down now. Indoor soccer, anything that's operating as an indoor sports facility is closed for a week starting Monday. and Director Coit, who's with me today, is going to be working very hard over the next week to come up with specific, actionable changes to contact tracing. We're going to need you to help us. We're going to need you to collect the information of all the contacts that are at every game so that it's at the ready for us. And we're probably going to come up with new testing protocols, because a lot of these sports that are being played indoors, they're close contact sports, and they're indoors, and we have a problem. So we want to work with you to figure out a stringent set of guidance so that we can reopen safely. Houses of worship. Another area where we've seen spread is in houses of worship. The pattern is the same. I know I'm a broken record up here. Services are an opportunity for social engagement, not just prayer. And again, that is a good thing. In normal times, we want to encourage that. We want to encourage the coffee hour after church. We want to encourage chit-chatting before you go into a service, after in the parking lot, hanging out with a group of people. The problem is, it is those unstructured, informal, casual gatherings with people who you know and who are comfortable with that are getting us into big trouble. So I am asking all faith leaders, effective immediately, to offer and strongly encourage virtual services. So I'm asking, some of you had been doing virtual and then you suspended that option. I'm asking you, effective now, to offer a virtual option and encourage a virtual option for everybody. I will say thank you to faith leaders. You have shown extreme leadership and partnership and compassion from day one. You continue to do so, and I want to say thank you. This morning, I had a conference call with over a dozen, actually well over a dozen of Rhode Island's faith leaders, and they all agreed to heed this warning, to offer and strongly encourage virtual, and we're going to be working with them in the coming week to come up with some new official regulations for houses of worship, which I may be able to announce next Thursday. I want to say this. If you do decide that you want to continue to go in person to service, to Mass, then the ask is that you go to the service, keep your mask on, keep your distance, and go home. No chit-chatting with friends on the way in, no cup of coffee after, no chit-chatting in the parking lot. Show up, worship, go home. Wear your mask, and don't go if you're sick. And if you are able to, I'd encourage virtual worship. Again, Christmas, Hanukkah, all year-end holidays are around the corner. We want to have our best chance at being able to enjoy that. I know, like in my own family, this is tough medicine, I'm saying. But I also would love to be able to go to Mass on Christmas Eve. I also would be able to love to be with my family around Christmas, and I want you to be able to do that too. So let's crack down now so we have a hope of being able to do that. Visitation. Unfortunately, when cases are increasing as they are right now at such a fast rate, there's a much higher risk of transmitting the virus to people who are more vulnerable, such as older people. Right now, we're seeing the most cases among 20, 30, and 40-year-olds, but our increases in hospitalizations are being driven, not surprisingly, by 60, 70, and 80-year-olds. The fact of the virus is still the same. The younger and healthier you are, the less dangerous it is. In fact, a lot of kids, young people, not just kids, young people under 25, they're asymptomatic. They don't even know that they have the virus. They're spreading it, but they don't even feel sick. but then when they go visit mom or dad or grandma or grandpa who is 80 or maybe diabetic or maybe underlying health conditions, unfortunately that person winds up in the hospital or even worse. So for that reason, we're going to be working extensively this weekend with our nursing homes and hospitals to scale back on visitation. This really stinks, and I get that. And we're going to do our best to make exceptions for certain circumstances. So I'm not saying we are shutting down visitation. What I am saying is that we need to protect our older relatives, and we're going to have stricter rules around nursing home and hospital visitation for the next couple of weeks. So we're taking a fresh look at our policies. There will be exceptions. I understand there's a need to be with loved ones. But I cannot underscore, there was a time in the spring when I was announcing 20 or 30 deaths a day in nursing homes. We're not going back there. So I am announcing today that there's going to be changes effective next week, lasting for 2 weeks. And over the weekend, Dr. Alexander Scott and her team are going to work with nursing homes to find that right balance between what is humane and necessary, but also what makes sure we never see another outbreak in nursing homes. I want to make a note about working from home. On Wednesday, I asked business owners to enable your employees to the extent that it's possible to work from home. I know not everyone can work from home, I understand that, but some people can, and if they can, I need employers to allow folks to work from home. I'm also asking employers to get creative to help us cut down on carpooling. A special note to manufacturers: your folks are carpooling. Carpools have not been shown to be safe. It's an area of spread. I know everybody has to get to work. I'm not saying we're outlawing carpools. I'm asking employers to get on top of this, particularly manufacturers, and figure out if there's ways you can help. Figure out if there's ways that you can help through schedules, offering transportation, possibly allowing remote work, and reminding folks, if you're going to carpool, even if it's with your buddies, open the windows, put your mask on. And for those of you who can work from home, please do that. Today I'm also announcing that we are making $5 million immediately available to assist businesses in the effort of allowing employees to work from home. So that could be, you could use some of the $5 million to buy laptops, software subscriptions, internet access, whatever you think would make it possible for as many of your employees to work from home as possible. That's available beginning today, and that's available at commerceri.com. Contact tracers, we need more. We're getting behind in our contact tracing, mostly because people have too many contacts. I just mentioned that party in the East Bay. It'll take us days. It'll take us a team of people for days to get through all those contacts. So not surprisingly, we're behind. If you have any interest, if you need a job, if you want a job, if you have some customer service experience, if you think it might be a fun job, you want to help out the cause, we're paying competitively. You will have to work some nights and weekends, but it's a great way to earn some money and help the cause. We need contact tracers. I made this announcement the other day. 100 people signed up. I'm making it again today. Maybe another 100 people will sign up. You can go to health.ri.gov/COVID jobs. Finally, Halloween is tomorrow, so I want to make a note about that. Halloween's for kids, little kids. You're still allowed to go trick-or-treating. Do your trick-or-treating before dark. Wear your mask. go out, alone with your parents or, an adult, or with a couple of kids. Keep it short, keep it distanced, wear your mask, and be home before dark. For the rest of us, we should stay home. For the rest of us, it's not a time to go to a party, not a time to have a party, not a time to congregate at a bar. It's a time to hunker down. State police presence will be tripled over Halloween weekend, and they're specifically tasked with finding and shutting down any parties, any restaurants and bars that are breaking the rules, and any violations of the social gathering limit of 10. I know still of young people planning to get together in small groups. I'm asking you not to do it. It's not okay if you even have 7 or 8 of your friends over tomorrow night and have a sleepover, or if you do, keep your mask on and keep your distance. This is a critical weekend, and I'm asking for cooperation. By the way, in a few weeks we have Thanksgiving, so it's a critical time right now. Rhode Island is not unique. All over the country, actually all over the world, we're starting to see spike. Just yesterday, 8 different states set a single-day record in the number of cases. You're seeing it all over the world. Germany's going backwards, Italy, etc. So Rhode Island isn't unique in that regard. Rhode Island is unique in our spirit of togetherness, in our can-do attitude, in our level of connectivity. It's been harder for us to keep a lid on the virus because we are so connected and we are so densely populated. But it also means we care about each other. We're connected to one another. And if we have to open up the Cranston Field Hospital, chances are you'll know somebody who's there. If we have to start closing down restaurants and businesses again, you're going to know somebody who's going to lose their job. In contrast, if we follow these new rules and seriously dial back our informal social gatherings, follow the 10 rule, and wear our masks, I feel confident that we'll turn the tide on this one. But again, it's not. I wish it could be different. I know there's fatigue. I know there's anger. I know there's frustration. I know everything I said right now is probably not that popular. I can't change the virus. All we can do is each and every one of us in our daily lives live in a more disciplined way, because if we do, then we're going to save a life.